Good afternoon, everyone. I'm Lisa Poff, the project coordinator for the Indiana Deafblind Services Project. And I want to welcome you to this afternoon's virtual workshop, Strategies for Working with Infants and Toddlers with Vision Impairments and or Multiple Disabilities, including Deafblindness, with Elia Landavillard. All right, at this point in time, I will turn it all over to Elia to get you guys going.
So much, Lisa, and thanks everyone for attending. Again, the title of this workshop is Strategies for Working with Students and Infants and Toddlers with Vision Impairments and or Multiple Disabilities, including deaf blindness. And you'll see on the right now I'm sharing my screen. There's a link to a Google Drive folder that has a copy of this presentation, as well as, and I'm waiting for it to pull up, as well as some of the documents that I'm going to be pointing out for you to use. You can use them obviously in your everyday practice, but also as part of the homework that you're going to have to use to prepare for when we come back in January. So hopefully you'll be able to implement some of this stuff depending on the COVID situation and whether or not you're going to be able to do face-to-face or distance. But you know, we're creative and we're innovative, and we will one way or another get it done because our kids still need services regardless of what's going on in the world. So
Yes. Sorry, just a quick note. I did email all those to those folks this afternoon, but it's good that you had the link up too.
Yeah, it's right there. If we can put it in the chat box too, if they want to be able to do it.
If you guys haven't checked your email recently, you did get an email with all of those files that she just showed you.
Yeah, and I mean, if
okay,
you want, just put the link in the chat box too if they want to use it there from that point too.
Okay.
Getting to the mailbox. So thank you, Lisa. And you're getting all this stuff today instead of before because I'm always running behind and this semester's been crazy. So it's not Lisa's fault, it's my fault. She does a wonderful job with all this stuff, and I'm just thankful that you know, I'm able to work with your project and with Indiana State. I used to work for Illinois State. So part of this homework assignment, and I'll read you what the directions say, that in this series of webinars, we are expected to complete an activity in between the time of this webinar, which is part 1, and part 2 of this webinar, which is scheduled for January 26, 2021. So in preparation for part 2 of this webinar series, participants will be asked to choose a student who on their caseload who would benefit from active learning. Participants will bring an example of a completed activity and goal matrix along with a picture of a piece of equipment they secured or made to assist with implementing activities from the activity and goal matrix. So obviously we're going to talk about all these things as we move through this. And also, obviously, this is not for a grade in particular. So, you know, if you're able to do some of these things and get consent for picture, video, those kind of things will obviously be flexible. And so I just want you to keep that in mind. But anyway, so, and I see there's some like typos here and I'll have to go back and fix that. And luckily it's in the Google Drive. So the fixes will be there in the drive for you. But it won't affect what it is we're having to do. So really quickly, before we, because I forgot to do this, just to give you a little bit of background on myself, I am the director of the American Printing House for the Blind Connect Center, the APH Connect Center. Prior to that, I was a parent engagement coordinator for the Deafblind Project in Illinois. And prior to that, I was a professor of visual impairments at Illinois State University. So I coordinated that program. And I was also a co-PI or co-principal investigator for the El Vista program, which was a program that we had, was grant funded through the Office of Special Education Programs, and it funded teachers of the visually impaired and orientation and mobility specialists It funded their training to become developmental therapists for vision or developmental therapists for O&M. And so it was a 5-year grant, and I think we ran it out maybe 2 years ago. There's another grant going on there as well to train, I believe it's TVIs and speech therapists to be developmental therapists for vision and developmental therapists for speech therapy. So anyway, so that's like my professional background in higher ed and state deafblind projects. But my I have teaching degrees as a TVI, special educator, bilingual educator, as a bilingual educational diagnostician, which is assessment. That part goes into assessment. So basically like a school psychologist, but as an educational diagnostician, we have to have had at least 3 years of classroom experience, and then we can move into the realm of being an educational diagnostician, where a school psychologist don't necessarily have to have the classroom experience. So my career was not only as a bilingual teacher and as a bilingual TBI, but I was also the lead bilingual educational diagnostician for the program for students with visual impairments in Houston ISD. And so with all of that, I was able to work with babies and all the way up to transition age graduation, up to 22 years old. So I'm really excited to be able to use a lot of that experience that I have, and a lot more of the research that's been done, to talk to you today about how to work with our kiddos who who have more significant needs than our kids who are I don't know what other term to use, but like when they say vanilla blind or just blind, because just blind is not just kind of like just being just a teacher, but our kiddos who have these more significant needs, and if they're deaf blind, we have to approach the way we work with them in a very different way. And active learning is one of the topics that we discussed the last time we met. And I'll kind of go over that in just a minute to kind of tie the active learning pieces together to then help us use the activity and goal matrices that we'll be talking about for our homework assignment in January. Okay. So I already went through the homework assignment. Sorry, I'm sure you can probably see my cat here. And so it's like, of course, he's taking half the desk. So I'm kind of, resigned to just this little portion of the desk. You know how it is when you have animals, they run the house, or at least cats do. So our objectives here, we will learn about and explain how to use an activity and goal matrix to focus activities that support the student's IEP or IFSP. Gain an understanding of how to use the activity and goal matrix, how it can also serve as a lesson plan, which is also really nice because we already have so many things to do, and then we have to do the lesson plan and the matrix and all these other things. So trying to incorporate as many things as we can into some of the things that we're going to be learning today will help ease at least one of the tasks that you have to do while you're out there as a TBI or service provider. And so it can serve as a lesson plan for the teacher and for the rest of the student's educational team, which is really important when we're looking at working with our kiddos who have more significant needs. And then we have we'll also learn about using the activity and goal matrix to align general education and ECC skills with their students' needs. So kind of what we're going to be trying to, get out of today. So let's look at first, what is active learning, just in case you weren't present at the last webinar, because all of these strategies, the goal, the matrix, the activity and goal matrix, all of the stuff ties back into active learning because we are dealing with kids with more significant needs. So with active learning, it is a way for us to provide developmentally appropriate activities for children so that they can learn new skills, especially for children with special needs. It's about providing an environment so that they can be an active participant. And in my experience, and I'm sure you probably have this same experience if you've been in the field as long as I have, One of the big fears that I hear or I've heard in IEP meetings, and that I hear from my students who are in IEP meetings. And when I say students, I say college students, because I still do adjunct for Indiana State University. And I also adjunct for San Francisco State and other BI programs who, tend to need an adjunct here and there every now and then. So when because I talk about the IEP process, and a lot of times, we want, I want the students to report back to me what their experiences are in IEPs, uh, and and I tend to focus on what are their perceptions of the family's experiences in the IEP IFSP meetings. And one of the things that tends to come up quite often is the fear that some parents have that their child is going to be just kind of put aside, and left alone in a corner while everybody else is actively engaging and doing things in the classroom. And maybe, and this might stem from their own experiences growing up, not necessarily growing up as a person with a disability, but growing up in a school setting where kids who were or who had disabilities were treated very differently. They didn't have that access to their same age peers and the curriculum. I know my brother, he had a developmental disability, and IDEA didn't really come into pass until the late 70s. And my brother graduated in 1981, so there was not a whole lot of opportunity for him to actually benefit from that as much as he should have. And so, and then of course my parents too, so like their experience was like kids with disabilities were put in T buildings at the back of the school and kind of like forgotten about. And so that is the one thing that I hear myself in my experience, and my students tell me that parents are afraid that that's going to happen with their kiddos, with their children, right? And so when we talk about active learning is it's called active learning for a reason, because our kids who have those significant multiple disabilities, who are deafblind, they have to be the active participant in their own learning. Like, we can't move forward until they themselves are being the active participant in their learning, and then we take our cues from them. So it's a little different mindset, because we're used to doing more direct instruction, but here the kid is leading the way. So and that has a lot to do with our ECC, self-determination, independence, those type of things. So active learning is one of the most important ways that we can work with our kids who have the more significant needs, more significant and severe disabilities. Oops, sorry. And so, because again, I'm just going to do this kind of quick review over active learning for those who weren't at the last webinar. Sorry, excuse me. I'm having allergies. I'm living among the cornfields, and there's a lot of churning of the cornfields around here because they're harvesting, and so it's just affecting my sinuses and my throat. So I apologize. So the foundation of active learning, it's based on the work of Dr. Lily Nielsen, who was a Danish educational psychologist. She was the second of 7 children, 4 of whom were born blind. And then unfortunately, she died in 2013, but she left us just a wonderful legacy, and of what she was able to contribute to our field because of her own personal experiences growing up in a household of 7 kids and 4 of them being blind. And then the other piece of active learning is it's a total approach for promoting the development of individuals with severe multiple disabilities. Okay, so that's just the basic foundation for active learning. Now, this is also important, thinking about who is this approach for, right? So remember, this webinar is about serving infants and toddlers, right? Students, and including infants and toddlers and kids who are deafblind. So when we're looking at infants and toddlers, obviously we're looking at, you know, birth to 3 or birth to 2 years, 11 months and 30 days. um, and then obviously then we're looking at maybe going into like early childhood, for other students. And then when we have kiddos who have those really severe multiple disabilities, a lot of our kids, I mean, I've worked with a 17-year-old who was functioning developmentally like a 4-year-old. Okay. And I'm sure I'm not the only one. There's probably, you know, a few of you in this audience who have, if not everyone in this audience has done that. So this approach is really good for our older kids who are functioning in that infant to toddler to early childhood range, and also really good to use with our infants and toddlers when we're in early childhood, when we're in there working with those kids who are up to 48 months, right? So this approach targets learners who function at the developmental age of 48 months or 4 years, but can also help those at slightly older developmental levels. Because remember too, we're also they may have some severe physical disabilities. And so some of the active learning activities will help work with those gross and fine motor issues that they may be having. So they may be developmentally lower in their gross and fine motor abilities versus maybe their other cognitive developmental abilities or disabilities. It's also appropriate for infants and toddlers and older learners with significant multiple disabilities, sensory impairments, vision or hearing loss or deafblindness, and autism. And one of the reasons too, this is a good approach for kids with autism is because a lot of the active learning approach deals with a lot of this sensory integration, which then gives the kids an opportunity to become very active in their and engaging in their own learning. And so you'll get to see some of that in just a minute. I'll pull up a few videos and I'll keep track of the time because I know I have you know, another maybe hour and like 5 minutes. So I want to make sure I leave time for questions. So there may be, well, I may not be able to get through every single video clip, but I want you to have an idea of what I'm talking about when I'm talking about sensory integration and kids with autism as well. And so, you know, and when we're working with kids with CBI, sometimes their behaviors can be confused with autism, but either way, these strategies and this particular method of instruction is appropriate for those as well. And I'll show you some of the resources. You know, you'll how I pulled a lot of the information from this one particular resource that's all about active learning. But when you go to that resource, it's overwhelming because there's so much information there. So I pulled information to just target on the things that you know, kind of like in those doable chunks, right? So I don't get overwhelmed when I go to that website and you see all of this extra stuff. We're just going to try to focus on the issues dealing with the activities and goal matrix that back to how go back to how our goals and our benchmarks and our objectives. Okay, so we're gonna walk through some of that as well. So I apologize if any of this is repetitive or you're like, okay, why am I even here? I know all this stuff, right? So just bear with me. We will work through this and we'll get to that matrix and how you can use it. Okay. So there are 5 characteristics of active learning, which again, the last webinar we went through. So we did the first characteristic is active participation. Again, that goes into the active learning theory and everything that supports it. Repetition, right? Practice makes perfect. Developmentally appropriate activities. So when we're thinking of developmentally appropriate activities, right, we're thinking of cognitive development, physical, you know, motor development, those kind of things. But we also need to be very aware of what developmentally appropriate activities look like for an older child who is functioning in this range that is appropriate for active learning, which is that birth to about 48 months. Um, if you have a 12 or 13-year-old who is functioning in that range, we don't want to use toys that are made for that age range because it won't look and feel as developmentally appropriate. Maybe not so much for the child, but for the parents, the families who come in, or who want to get an example or see how what their child is doing in the classroom. We always have to remember that this is someone's baby, and it's it can be very traumatic to have a child like that requires so much attention, and extra care, and there's a grieving process that goes along with that. And so if we have a parent who sees us working with the stackable rings for which we have for a little baby with his or her 12 or 13-year-old son, that can be traumatic. So we need to be really aware of there are other materials out there that can at least be developmentally appropriate, but also look developmentally appropriate as well. So we have to make sure that we walk that fine line, because we also want to make sure, because if that student is aware of their age, or sometimes we don't give them enough credit for understanding what people are saying. You walk into some classrooms sometimes, and the teacher, the paraprofessionals or the teacher or whatever, like they're talking about the student while the student is right there. And we really don't know how much that they're actually comprehending sometimes. I mean, I've worked with a student who, at the time, this was before Rosa's Law in 2010, we still use the words mental retardation. And he was very well aware of what that meant. Even though he was, intellectually disabled, we still were using mental retardation to refer to that because Rosa's Law hadn't been implemented yet. And before we had our IEP meeting with him, I had to sit and talk with him about the words that he was going to hear and how that didn't mean that he's not capable of working and living a good life, a successful life. And so our kids who have these severe and multiple disabilities, we need to remember to give them the dignity that they deserve and not talk about them like that in front, or mention words like that in front of them if they may have a sense of what that may or may not mean. And so, I know it sounds very PC, but it's really not PC. It's about, giving all of our students the respect and dignity they deserve, and their families as well. So I just wanted to bring that up in there when just mentioning developmentally appropriate activities, but also reinforcement and limiting distractions. So those are 5 characteristics of active learning. Now, beyond the characteristics of active learning, those are, like I just mentioned, the 5, right? There are actually 5 phases of the educational treatment. So we have the overall characteristics, like this is kind of like the theory behind it, and what we need to be doing if we're going to be implementing active learning, okay, within those parameters. Now, as part of those parameters, here is how we actually implement those characteristics, okay? So there's 5 phases, and these 5 phases provide teachers, professionals, and parents with the techniques necessary to treat the emotional and social level of a learner, as well as academic, cognitive, or physical ability level. So the 5 phases are, you've got phase 1, which is offering, phase 2, which is imitation, phase 3, interaction, phase 4, sharing the work, and phase 5, consequence, okay? I'm going to, I'll go to the next one, and I'm gonna have to round back to this one because I wanna pull up a video that just kind of gives you an example of what phase 1 looks like. It's easy to, talk about what offering is and all that stuff, but to see it and how it's implemented, using those active learning theories and characteristics that kind of, the parameters that guide us through that. So I'll go to the next slide, just to kind of give you a little more information about phase one, which is the offering phase. And then I'm going to pull up that video and I'll start it. It's a long video, but we're obviously not going to watch the whole thing. I'm just going to show you a clip of it, just to give you an idea of what it looks like. But the purposes of, the phase of offering are to promote trust between the learner and the adult, to observe the learner's reactions, to identify what the learner likes or dislikes, to establish an understanding of the learner's emotional level, and to introduce self-activity. Okay, so keep in mind, like I said, there are 5 phases. So we have to keep in mind that the kids that are at those earliest developmental levels, like birth to an emotional level of like maybe 2 years, typically need the adult, to utilize the techniques in phases 1 through 3. Now you think about birth to 2 years old, emotional level of 2 years old. You think about a typically developing child at that age range. They need a lot of adult intervention, right? They need a lot of adult support. They're still very dependent on adults. However, they can still be encouraged to be independent and to actively engage in their environment on their own, right? And so that's where you might have parallel play, or they have their own their play time in their area, in their activity. That same mindset or that same thought goes along with kiddos who we have with disabilities, or with multiple disabilities, or with deaf blindness, who are functioning in that birth to about 2 years old level. They still need the adults very much to help them to utilize these techniques in these first 3 phases. So right now we're focusing on phase 1, which is offering. So, but the most important concept to understand here is that no demands are placed on the learner at all. Like, you're not giving the child a drum and a drumstick and saying, hey, play the drum. You're not. You're just giving them the activity or the items, and then they are allowed to explore, to accept or reject the item or items, right? We're not placing demands or anything. We are observing. We are looking for what their reactions are to what it is that we are placing in their very near environment. Okay. The only request that the adult is actually making is that the learner allows the adult to play learner. And this is a nonverbal request. Like, we don't have to ask, hey, is it okay if I come and sit with you and do A, B, or C? Like, it's all nonverbal. Because also we think about that sensory integration. Kids with multiple disabilities sometimes have a difficult time combining the auditory and physical movements all at the same time, especially if a kid has CVI. We know this from working from all the things that we're learning about kids with CVI. And so really that's really the only thing we're doing when we are working with a kid like this. We are in their space, we're giving them something to become actively engaged in, and then we're sitting and watching, which is one of the hardest things for us to do as teachers. It's almost like that wait time, right? Like, somebody tells you you ask a question and you wait for like 10 seconds, like that 10 seconds seems like 3 hours. It just does, right? So, and you'll see in just a minute in the video I show you, you're going to be watching and you're going to be like, okay, are you going to do something? Are you going to do something? But you're watching the kid, and the kid is adorable, and the adult is just sitting there watching and waiting for the student to react and to engage. And that takes time. It takes silence. And from the adult who's working with the child in the video, there's some background noise that's going on, and you'll hear, depending on how much we see of the video, the teacher will say, hey, can you switch that off, please? Or something, because again, we're talking about distractions and integration, sensory type integration stuff. So you'll get to see all of that in just a second. So again, this request is nonverbal, and we're the adults are making the offer of the activity. And then the learner, the student, the child, the baby can accept or decline that offer. Okay. And so let me go to, oh, maybe that's not the right one. Oh yeah, this might be it here. Oh yeah, okay, we go, sorry. Okay. I'm
Phase 1, offering using.
I'm gonna go to, all right, let's try there. Oops. Nope. You can see this is like a 30-minute video, so we're not gonna go through the whole thing, but I'll show you just a clip, couple minutes.
This activity is an excellent example of offering, which is the first of the 5 phases of educational treatment outlined by Dr. Lily Nielsen. During this phase, no demands are placed on the learner, and the learner decides whether or not to interact with an object.
What the teacher is holding in her right hand is a scalp massager. So it's vibrating those looks like those little wires that they're vibrating, and she has it on his tummy and on his leg. And then you can hear him kind of like talking in his own way, recognizing what's going on. So it's extension.
Cindy turns off the massager and puts it away. Note that again she does not speak, but rather just quietly reaches for the next item. Cindy presents a vibrating brush. Jack reaches for the brush with the index finger of his right hand. As before, he removes his hand and then reaches back to touch the brush a number of times. Cindy places the vibrating brush on Jack's left foot. He immediately starts to whimper and fuss. Cindy says to Jack, "Do you feel that tickle in your feet?"
Your feet? You're tickling your feet?
She asks him if she should turn it off, and then does so, while saying off.
Turn it off? You turn it off?
Cindy doesn't dramatically respond to Jack's negative reaction to the vibrating brush, but simply acknowledges that he would like to move on to something else. She repositions Jack and reaches for a different object. Cindy repositions Jack and reassures him that it's all right, and she doesn't end the session just because Jack is being unhappy. He quickly adapts, and Cindy holds a clatter suspended near his right hand. Again, because this is the offering stage, she simply presents the object to him without comment or requesting that he do anything.
Okay, so I mean, it's a really interesting video as you watch the rest of it, but you can see how, she was just had the vibrating head massager first, and he was kind of interacting with that. She just changed the object and did the brush, and he was kind of interacting with it, engaging with it, and then of course he communicated to her when he did not like it on his feet. That was probably very ticklish for him, poor thing, like that just was uncomfortable. So that's just kind of one example, a short example of offering. And you can see how much patience it takes, and how, I know me, when I would have offering him that next thing that had all the different colors, it looked like a fish kind of hanging on a hook there with all these different rings around it. I would have been, oh, look at this, maybe you might like this. Why don't you reach out and that's not what we're supposed to do in active learning, because it may be just too overwhelming. We want them to engage and kind of guide us as to where we need to go. Okay, so that was the phase 1 offering. Let me get over back to the PowerPoint over here. Okay, phase 2, which is imitation. This is how you can implement. This is one of the strategies for active learning, and how to implement the activities for that line up with your IEPs or your IFSP objectives, benchmarks, plans. So for phase 2 imitation, the purpose of imitation are increase the learner's interest in activities nearby, increase the learner's ability to initiate, increase the learner's belief in him or herself, and to introduce activities and movements not yet performed by the learner. And so again, I'm going to exit out of this. Oops. And I'm gonna show you another example. No. This one's a lot.
When the video begins, we see Cameron seated in a stroller with his brother Hollis kneeling before him. Throughout the activity, Hollis stays in close physical proximity with his brother. Hollis and Cameron each have a bumpy noodle ball with an 8-inch flexible strand attached to it. They mouth the ball. They then explore the space between the bumps with their index finger. Cameron and Hollis hold the ball by the flexible strand and twirl it in front of them. Cameron puts the string in his mouth briefly, then once again explores the ball with his fingers. Hollis does the same. Cameron rolls the ball around while holding it with his index finger, causing the string to flip back and forth before mouthing the string briefly. He seems to notice that his brother is imitating him.
He's looking at Hollis, doesn't back at his.
Cameron takes a short break and turns his face into the side of the stroller. Cameron bites on the whole ball and looks at his brother doing the same thing. Hollis and Cameron twirled their balls by the string and bumped them together. Both seemed to be smiling.
Okay. All right. Okay, making sure my video came back on. So you could see there the imitation, right, with his older brother. And you can also not only see that the older brother was imitating the younger brother, it was that the younger brother was initiating what the older brother was going to be imitating, right? And he recognized that. So it gave him control over the activities, and he was engaging his brother in the activity. There was no communication other than nonverbal going on. But also you notice that the young boy in the stroller was taking interest in the activity that was happening nearby him, which in this case, right in front of him with his brother. You can see that interaction, you can see that imitation, and him kind of pushing the boundaries. Okay, well, you're biting it like I am. Let me see if you can copy me doing this, right? So it's this like, again, that goes back to that self-determination, the belief in him, or him or herself. So it seems real simple, and it seems like, oh, they're just playing. But for kids with multiple disabilities who have more significant needs for their education, this is a big deal, right? Because again, remember, I always go back to when I'm teaching at the university, teaching people how to be teachers of students with visual impairments. I go back to, you have to remember, again, this is someone's baby, and they have been told from the time that that child was either born with the disabilities or somehow acquired the disability, that their child would probably either not survive or would only survive to live for so many years, or if they survived and lived a long time, that their quality of life would be very small. They wouldn't be able to learn, they wouldn't be able to do anything, right? And so being able to show families, look, this is what your child is doing. I mean, imitation, for this child to recognize that imitation was happening, that's higher level, that's a little higher level thinking, right? It's not just, I'm doing this. He's recognizing that he has some control in this situation. And so that's why it's really important to make sure that we're following the characteristics of and the theory behind active learning, and then going through these phases of how to implement the active learning. Okay, I'm trying to pay attention to time, so I won't be able to show examples of the next phases, but you'll have the links to the videos are in the notes section of the PowerPoint, so you have access to that. And also these titles are hyperlinked, so you could get a lot more information about the phases. So if I click on phase 3 for interaction, it will take you directly to active learning space and give you a lot more detail about phase 3, general guidance, what your role is as an adult. And then of course I have right here what the purposes are, because that kind of brings it down together for us. And then there's some video examples here. So just because we don't get to the actual videos now doesn't mean that you won't know where to find them, because I've linked them here. So for phase 3, we're looking at help the child learn dependency on another or several other people. Okay. And that comes from the website about learning dependency. But I also, and we talked about phase 1 through 3 is typically that birth to 2 years old age range, where we have some kids want to be more independent with what they're doing, but yet they know they need to learn that there's an interdependency relationship going on. But we could also add learn independent, learn to be independent for some activities versus others. So keep that in mind as well when we're looking at phase 3 and when you're reading about it and when you're working with your student, because each child is of course unique And so you can, do what you feel is use your professional judgment and do what you feel is appropriate with your particular student in their particular situation. It's also to help the learner initiate interactions. And so with the last video we saw was not only imitation, but he was actually initiating different thing, right? Like he was initiating like some of the imitation activities where he was recognizing that the brother was actually imitating him, and he was like, okay, fine, how about doing this? So he changed what he was being done to see if the brother would imitate him, right? And so you're thinking about looking back at all these different things. What was happening in the imitation video could apply to also some of what was happening in the imitation video could apply to the interaction piece as well, because he was interacting, right, with his brother, basically without telling him like, I dare you to copy me doing this. And he did, right? Because you could see it in their smiles, and all that nonverbal communication was there to clue us in as to what was going on in the child, and maybe in his mind, and what we were looking at. So this will help the learner initiate interactions, enhance a child's development of self-identity, and gives the child the basis for social development. And so again, looking back at that video for phase 2, you can see how some of this ties into phase 3 as well. Sharing the work. So I'm gonna, like I said, I'm gonna kind of fly through the phases so we can get to the matrix. For sharing the work, one of the purposes of sharing the work are to increase the learner's experience of success, involve the learner in new social relationships, and increase the learner's interest in acquiring new abilities. And then there is like I said, in the notes part of the PowerPoint, there's a link to another TSDBI clip that demonstrates this. And of course, there's the link that goes to the page where it has more information, and the video is at the bottom of that web page as well. And then we have phase 5, which is consequence. So the purposes of phase 5, or the purposes of the phase of consequence, are to help the learner to endure meeting demands, help the learner endure changes in life, help the learner feel self-confident, which is fundamental in making your own decisions about your life, and to establish a sense of responsibility. Okay, so all of that is all goes into active learning and the theory behind it, the characteristics behind it, and now the phases help us implement strategies to help our kids meet the demands of all these different phases of active learning. Okay, so I'm moving on. What is the activity and goal matrix? So in active learning, almost any activity can be engineered to provide opportunities to work on almost every IEP and IFSP goal. Okay, and I do the interchanging IEP and IFSP because this not only can work obviously for early intervention, but at early childhood and older children, students who have severe or significant multiple disabilities, including deafblindness. So looking at an activity and goal matrix, it can help you evaluate whether or not your planned activities provide a focus on the student's IEP goals. Whether we're doing so many things when we're working with these kids, and we're working with so many people, right? So many service providers. We've got an occupational therapist, a physical therapist, a speech therapist. Sometimes you've got, depending on the level of the student, you might have the adaptive PE teacher. You might, there's other therapists that come through that work with our kiddos. And then not only that, a lot of our kids are also getting outside therapies, right? From the medical model. We're doing the educational model. And so being able to focus down and making sure that these activities, while fun and engaging, that we're also making sure that we're meeting those IEP goals, because that's what's driving, right, our planning and our educational placement and our goals. So we want to make sure that we can do that. And this activity and goal matrix helps us make sure, it's kind of like a check on the system, right, to make sure that we're doing that. And so it serves as a big part of our documentation. And also ensures that there are ample opportunities in all activities to work on these goals. Okay. So, we have to be sure that we are infusing like these skill building opportunities throughout the day. And of course, in a variety of environments, which is really important, right? Because we're looking at making sure we want skills to be generalized from school to home and home to school, and different environments within the school and within their day. Okay, so real quickly, let's talk about IEP, IFSP goals, objectives, and benchmarks. So we know goals are, what the students expected to attain, right, during the course of one school year, right? And that helps us, narrow down our focus on our instruction and how we're gonna teach our kiddos. They also represent only a sample of what the child may actually be working on at any time during the day. Okay, so obviously there's a lot of things we can work on with our kiddos, but we have to look at their present level of functioning, what skills they have, so that then we can use where they're functioning now, right, to scaffold and build upon those skills to help them move forward. So it requires us to really be able to drill down and focus in on those areas. Oops. Okay, and then they also serve as a way to monitor whether key elements are being focused on based on the priorities set by the family. Remember, because IFSP, we're looking at families and the team. You may have the child working on reaching and grasping, maybe using a little room, but it doesn't mean that the child might not also be learning how to use their vision and hearing to locate a preferred object. So yes, they are working on gross motor skills, but also if they're using their vision to find something that they want, or they're hearing because something is clinging or banging on each other, and then they're able to look in a different direction. So we're looking at like multiple ways to address different IEPs. So an IEP from the vision teacher could actually piggyback on top of an IEP from the teacher of the deaf, hard of hearing. And that happened all the time when I was out there in the schools doing this work. And then of course, goals and activities can be infused into a single activity or into multiple activities throughout the day, to be sure to allow for adequate time to repeat and practice skills. Remember, that goes back to repetition, practice makes perfect, that kind of thing. So we want to make sure that we our goals and objectives and our benchmark, doing that planning allows for that to happen. Active learning approach to our IEP, IFSP goals, objectives, and benchmarks. What does it look like, right, when we are using the active learning approach and having that reflected in our goals, objectives, and benchmarks? One, it should be positive, and describe a skill that can be seen and measured, right? Everything, of course, has to be measured, right? Those SMART goals, right? The measurable goals and skills. And then, of course, they answer the questions: who, will achieve it? What skill or behavior? How, in what manner, or at what level will this be achieved? Where, in what setting, or under what conditions? And when? By what time? What's the end date, right? Because that's where those benchmarks go, right? Throughout the year, we have our goal for the whole year, and then what our objectives are, and then what benchmark is going to let us know when to move on to the next, the next level, the next objective. So I'm going to click on this link down here to look at some examples of goals related to active learning. Oops. Well, I'm going to scroll down. So you see we have that. So like for physical therapy, if that's what we're going to be focusing on for this student, and the physical therapist at school is writing goals related to active learning, like who is a goal for the student? What the skill or behavior? Well, the student will reach and grasp a variety of preferred objects using a palmar grasp without being prompted. How? What manner, what level? At least 10 times during a 15-minute observation period through weekly observations conducted by staff. Where, what setting, what conditions? When placed in specific learning environments, like in a little room, near a position board, or on a resonance board. When, during independent play, during adult-child interactions, using the techniques of offering and imitation. So you see how offering and imitation, which is one of the strategies and how the implementation strategies that we use, the educational treatments that we would be implementing for active learning, they're actually mentioned in the goal setting here. And when? By the end of the school year. So like, you can give the well, I wouldn't give the actual date, because if there's like in Indiana, maybe snow days or whatever might alter the date, but by the end of the school year, whenever that is. Okay, you see how you can do that with math, with literacy. And then we go through the benchmarks or objectives. Oh, hold on a second. Okay, so with this, I want to go back and I want to show you where the documents are. And that's going to be my, no, where's that? Oh, there it is. So in our Google Drive, the document that you can use to help you organize your writing of your goals and objectives would be right here. And you can see who will achieve it, what skill or behavior, how and what, how, in what manner or at what level, where, in what setting or under what conditions. Oops, looks like there's a typo there. And then when, by what ending time or date. I'm going to make that correction right now. Since it's a Google Doc, it'll save it. There we go. Perfect. So then you can see this is one of the documents that can help support you in going through that piece of your planning. Okay. I'm going to go back. Here we go. Okay, so we saw some examples there. And again, going back to this website, it like I said, it's hyperlinked. You can see lots more examples of how the different goals, objectives, and benchmarks are written on the website itself, but then you can also see how that can fit into that document that I've shared on the Google Drive. And I actually have an example of, I pulled some of the information from what we were just looking at on this website into one of those documents. And actually that it might be a good idea for me just to go back real quick to the Google Drive. So here's an example. So you can see from the website how it looked on the website, but then taking the physical therapy information from that website and plugging it into this table, to me, it's just easier to look at and it's easier to wrap my head around than going through that website, because the website, again, it can be overwhelming. There's just so much information in that website. It can just, like I said, be completely overwhelming. Look at how it looks here versus how it looks here, which is still, it's clean here as well, but it's just with all the other information that's here, it can, to me, it was like, well, wait a minute, I just want to pull this one piece out. So so you can practice actually filling in that document by just going back to this website and moving this information into those rows and columns, if that helps you feel a little more comfortable and less anxious about the homework that we're going to be taking on. Okay. So evaluate your plans using the activity and goal matrix, right? Okay, so here is where the activity and goal matrix fits in. It helps you evaluate whether or not your planned activities provide a focus on the student's IEP or IFSP goals. So that document that we just looked at, those tables, right, that had the who, what, where, how, that, that information there, for physical therapy, for math, for, you know, whatever it is that you're going to be writing your goals, objectives, benchmarks for. You're going to take that information and then you're going to be able to plug that into this activity and goal matrix to help you verify that what you are doing or what you are planning, the activities you're planning, are going to be meeting those IEP goals that you, or IFSP goals that you're planning. Okay. So it'll help you, again, like I said, it'll help you evaluate whether or not your planned activities provide a focus on their IEP or IFSP goals. And early intervention, this is really good too, because it's coaching, you know, because they're coaching the caregiver, right? It'll help them, you'll be able to coach them to infuse those skill building opportunities throughout their day, like in their routines, because that's what we focus on, right? Early intervention routines. We don't want to add anything to the family and what they're doing, but we want to look at their routines and how we can infuse some of these activities into their routines so that they are practicing and helping that their child build some of those skills, right, that we're focusing on in the IFSP. So to infuse that skill building opportunities throughout the day and routines, and or a variety of environments, which then of course can lead to generalization of skills and then hopefully independence. But the added bonus is that it can also work as a lesson plan for the service provider or teacher. So we're not trying not to add one more thing to the amount of paperwork and, you know, another thing to your plate. If you're doing this, this can actually be used as your lesson plan. So, you know, that's something to keep in mind as well. More added bonuses. It can work as a lesson plan, like I said, for the service provider or teacher. You can also share this with the IFSP, IEP team to assure everyone's on the same page. So like if you're doing all of this work and you're meeting with everyone, or you can Zoom with them, or, you know, figure out how you can collaborate with them, you know, you are kind of, you are the lead for that student. If you're the TBI or the TDHH, you can share this with them to make sure that everybody's on the same page. We all want to be working on enhancing that student's skill or getting them to gain a skill. And I don't want the PT to undo what I'm doing. I don't want the OT to undo what the PT is doing, which then is going to undo what I'm doing. So by doing this and sharing this, you're making it easier for the team to work together for the benefit of that student. You know, helping make sure that the plans that they are or the things that they're planning and implementing can reinforce the skills that you're working on as well. And of course, it'll help with their own lesson planning. It can be copied each week with only slight changes in the activity. So like, you're not like redoing lesson plans every single week. I mean, you're using the basic same lesson plan, but you are just making those small adjustments to it that reflect the student's progress, and that you're having to make those adjustments to move down the line of the developmental skill for that student. And of course, bonus, collaborating with the team using this matrix can help the entire team plan a full day of study or activities that can bring in general content aligned with the child's peers, right? Which is what we're supposed to be doing to the maximum extent appropriate, and allows for those ECC skills to be included throughout the day. Now, I will say, I know right now, California is getting ready to implement in their state education law that the ECC must be addressed. Right now, I know that that's not the case in every state. I mean, we know as TBIs that we need to be addressing the ECC, but I know that there are professionals out there and different places where if it's not required, they're not going to do it, which that's a whole nother webinar, a whole nother discussion. So, you know, we need to become accustomed to, if we're not already doing that, how to make sure that we are addressing the ECC within our planning, within our activities that we're doing with our students, so that we can help them reach those ECC goals as well. Okay, Dr. Nielsen, who is the creator of all this active learning, you know, the active learning stuff that we're learning about now, she recommends alternating between the gross and fine motor activities. including, she also recommends that we include in some activities, both types of motor activities, right? Both physical, gross and fine. And she says, the order of activities can be varied. We don't want our kids, I get our kids need routine and a schedule, because people, they're no different than we are. We like to know what's coming. we like to be prepared for that. However, we can vary them up a little bit, because that's also part of learning. That yes, as much as we can, we want our routines to stay the same, but sometimes things have to get changed up, like when a fire drill happens, or some other kind of drill that happens, or there's a special assembly, or there's things that happen in a school day that can change the order of their routines. And so sometimes we can vary their routines on our own when we're doing active learning, but also some will stay the same day to day, right? Like toileting, lunch, nap time, like those kind of things. So at least there is still some semblance of a routine for the student, and we're not throwing them completely off, but we're also giving them that opportunity to learn how to accommodate and adjust to changes in their day when they do happen. So activity and goal matrix. So let's look at an example. I just did a screenshot of the web page, this active learning space, the implementation of activity and goal matrix. Okay, so I'm just going to scroll down. There's a lot of information here, but basically the activity and goal matrix, it looks like a table, and you've had your activity right here goes here, like the activity that's happening on day one, because you can do this for like a whole week, right? 5-day stretch. And then you've got your goals up here. So you've got gross motor goals, fine motor goals, communication goals, reading and science goals, and feeding for this particular student. There's this example is based on that's included here. But again, in the interest of time, I'm going to skip that. And of course, you can always go back and take a look at it when you're trying to put your own case study together. So for example, travel from bus and greet staff and peers. So looking at gross motor, that would apply, right? Because they're using their legs and feet to explore surfaces in various positions, like lying down, sitting, or standing. So traveling from the bus to greet staff and peers, I would say that's a gross that can meet or help us meet the gross motor goals. Fine motor goals: cross midline, left to right and right to left to reach and grasp objects. So that's the fine motor goal. Here you put the activity. If like here, walking, I mean, there's not a specific activity that you might be planning to help address this particular goal, but we know that traveling from the bus to greet staff and peers is going to require the student to use their legs and feet. So that's kind of like the activity there. It's kind of an obvious one. But for this one, how do we use traveling from bus to and greeting staff and peers? Like, how do we use just walking to help with this fine motor goal? Well, while the student is walking, there are activity boards on the hallway walls, or there are tactile symbols and landmarks. And so we can have the student be following the activity boards that are on the walls, using their hands, their fingers, so they're fine motor. So that activity goes, this activity here is supported by this specific activity to help meet this fine motor goal, okay? For communication, take a turn in an adult-child interaction. Well, we want the child to be greeting staff and their peers. So we can put an X there that this communication goal is being met through this particular activity as well. Reading and science goal: explore objects using various senses, touch, I could argue myself, again, that there's no right or wrong to this. It's all professional judgment. I could argue that using these activity boards on the hallway and having the child tactilely touching them and, symbols and landmarks would actually fall under exploring objects, using their touch, right? But this one also goes in when offered by an adult. These are not necessarily offered by an adult. However, I would still put an X here, and I might put an explanation as to what, if I feel like I need to, but I would put an X here because to me it just seems obvious that they are exploring an object. However, this object is not necessarily being offered by an adult because it's already on the wall. So that would probably be the added caveat that I would add. Like it's not, this particular goal is not being offered by an adult. However, they are still exploring tactile. But again, that's my thing. You don't have to go along with what I would do. You use your professional judgment. Feeding, using a spoon and palmar grasp to scoop and bring food to his mouth, that is definitely not happening with this activity, right? So, and then there's more activities here, and you can see the X's that are put in that indicate that the goals are being addressed, not necessarily being met, right? But being addressed by these particular activities that are going on. And I'm just keep going down. This is like the activities for day one, what happens during the day for that student. Then they have another one like this for day two, all the way for day 5. So what I want to show you is how I just took the information from this day 1, from their table here, and I put it, an example, and in one of the documents that you can use to do the same. So for day 1, I took what was on the website, and here's the same kind of table, but obviously looks a little different than what's on the website as far as like the format and how it looks. But their physical therapy gross motor goal is here, and the activity exploration time in a little room near a position board or on a resonance board during independent play and during adult-child interaction. So this came from, as we were scrolling down, you saw all of the other activities. I just pulled one activity from that, and I placed it in here so you could see how when you're making your plans, you're pulling activities from your goal document that you're planning, and you're putting it into your activity and matrix goal. Okay. And by doing this, we are verifying that we are using active learning activities, and that those active learning activities are helping us reach, or at least helping us address their gross motor goals, their fine motor goals, their communication goals, whatever the goals are that we are focusing on in their IEPs and IFSP. Oops. Okay. Let me go back. So then here you can also see another example of pulling that information and putting it into the table that you have. Okay. Oops. I need to make it bigger so you can see it better. Oh, why didn't I do that? That was weird. Sorry, it's not letting me do the full screen. So let me see if I can just make it bigger myself. Okay. So then there's like I said, this document or this table is in your Google Drive, in the Google Drive that I've shared with you. And so this is what you will use to document what activity you would implement with your student to help address the goals that you have for your student in gross motor, fine motor, or communication, or reading and science, or feeding, right? And of course, this is for that. You might have a student who doesn't have any feeding goals. I don't know. But again, there's no right or wrong type of student. There's no right or wrong goals or activities. It's just a matter of you focusing down on the types of activities that will help you meet those IEP or IFSP goals benchmarks. Okay. I'm going to go to the next information from the goals and benchmarks and activity and goal matrix. So again, you're pulling information from your plans of what you have done and plugging it in to make sure that you are, again, your activities are helping you meet those IEP goals and objectives, or IFSP and IEP goals and objectives. So I also have the link. This is hyperlinked. That'll take you back to the web page that gives a lot more detailed information about this, this particular matrix. And also you've got this link to go back to the website for that. Resources for making or purchasing equipment. So again, I can't advocate that anybody purchase anything or, or say, hey, you guys need to go to LilyWorks to buy this stuff. There are resources here that I've included that give you ideas on how to make your own equipment. And you saw, and when you look at some of the videos, it'll give you some other ideas as well of the type of equipment or objects that you can use when you're doing active learning with your students. Again, there's no right or wrong. It's just all depends on what your resources are and what you have available and what the students' needs are. So, and then there's lilyworks.org, which is Dr. Nielsen's website. And she sells a lot of the resonance boards and little rooms, stuff like that. But a lot of people end up making their own little rooms and resonance boards. And the way they can do that is this particular PDF. Also, I know I'm getting close to time. I want to leave some time for questions. Tells you how to make the little room itself if you don't have the money to purchase one. I've included a list of things that you can make here. So if you can go and click on here, it'll give you instructions and examples of how to do that. Make sure, and there are some considerations that you need to think about when you're considering making or choosing equipment for your students. So here's the homework. I'd like for you to choose a student, an infant or toddler, or a student who's functioning up to that 48-month developmental age. Use the active learning writing IEP goals and objective form, which is in your Google Drive, to write goals and objectives that reflect an active learning approach. So here I would say try writing at least 2 IEP or IFSP goals and benchmarks with a skill that can be seen and measured. I don't expect you to do 5 days worth. I don't expect all of the, don't get overwhelmed by what's on the website when you're starting to go through and look at this stuff. Use the activities and goal matrix form to input information from your completed active learning writing IEP goals and objectives form to evaluate whether or not your planned activities provide a focus for the student's IEP or IFSP. Try to complete at least 2 days. If you only do 1 day, that's fine too. I would say, up to, I should have said up to 2 days. You can do 1 or 2 days using the information from your active learning writing IEP goals and objective forms. That will help you verify that your activities are actually helping you work towards meeting those goals and objectives. You can get permission, video record yourself working with the student while you're implementing this to go along with this, so that when we meet again, you can show us what you did and how you did it and explain your matrices. And then of course, be prepared to discuss your case study student when we all meet again. We'll, depending on how many people are in the webinar, we can either do it as one big group or break up into smaller groups. So it just, we'll play that by ear. So, and then of course, there are resources for this presentation. Like all this information came from these websites. The issue is bringing it all together in a more compactable form for you. And then there's my contact information. Thank you so much for hanging in there. I know it was a lot. Hopefully you'll get to practice doing some of this with your student, and we can talk about the things that worked and the things that didn't work when we meet together. Okay, so don't feel pressured like it has to be perfect, because it probably won't be the first or second or third time you do it, and even up to 5 or 6 times. So it's okay. Thank you again. I'm sorry, Lisa, go ahead. I know I'm running, never enough time. This could be a whole class, like a semester long class. Are there any questions? Oh, Lisa, if you're talking, I can't hear you. It looks like you're talking because the little yellow is around your name and stuff.
Okay, Alea,
So, okay.
I have absolutely zero sound right now.
Hmm.
So I'm not sure what you were saying or where we are.
You have no sound. Wait.
I think it's me, not you.
Oh. Huh. Okay. I will put in the chat. Okay. Okay. I'm looking at the chat right now to see if there's any questions, and I see that that a request was made for me to share or copy and paste the link from the PowerPoint to the Google Drive, and I can definitely do that. I stopped sharing, so oops.
Okay, so my sound finally came back.
Oh, I don't know. Isn't that weird? I'm putting I'm copying and pasting the Google Drive. There we go. In there.
Great. All right. Any other questions, folks? You're very quiet today.
I probably scared them and overwhelmed them. There's so much stuff, you know, and like I said, this could be a semester long class, really. There's so much in here. If you have any questions, like Lisa said, get a hold of Lisa, or you have my email as well. And, you know, I can get them answered for you. Just remember, if you haven't done this before, it's not going to be perfect. You know, it's just a matter of going through the process of the planning and using those forms to help you focus in and on those activities that are going to be helping you help that child meet those goals that you have, and or helping the families helping you meet the goals that they have for, you know, if it's an early intervention situation that way.
And if there's nothing else for the good of the order, thank you guys for coming. Thank you, Elia, for talking and sharing all of that information. And we will see everybody in January.
Yes, we will. Yep. Everybody stay safe. Have great